Let's give it a minute because I have 7:29, and just in case somebody else shows up, we'll compare regional pronunciations as we go along. Well, good evening, everybody, and welcome to our March 2021 Cocktail Judaism. Incredible as it might be, pretty soon we will be marking the first anniversary that as a congregation we went on lockdown and quarantine and had to retool and begin to do our programs in a variety of different ways, including the Zoom format, which you are receiving tonight. We are thrilled to have Shari Rudavsky with us for this episode of Cocktail Judaism. I'd like to welcome you all. And as it is Cocktail Judaism, toast l'chaim to our guests and to all of you, and hopefully to a spring of renewal. L'chaim. A brief word about Shari before we start with the program itself. Many of you are familiar with her, even if you have not met her before, because you probably read her columns in the Indianapolis Star, for which Shari covers health and medicine, which these days significantly amounts to writing about the coronavirus pandemic. She is originally from the Bronx. She has worked at the Star and lived in Indiana for more than 15 years. Shari holds a PhD in the history and sociology of science from the University of Pennsylvania. She and her husband, Peter, who is a professor of medicine and director of the IU Center for Bioethics, have been members of Congregation Beth-El since 2010 with their two sons, my good friends, Sam, who goes to Sycamore, and Solomon, who goes to Orchard. We look forward to seeing them in the halls of Congregation Beth-El and at services in the hopefully not too distant future. As we were beginning to look to the 2021 programs, we decided that we needed to bring Shari on to give us some insights and to give us an update and to tell us about how the newspaper writing and reporting has centered around this issue. But before we go to the specific subject of our conversation tonight, I'd like to ask Shari to tell us how you got into newspaper writing and reporting, and specifically into covering health and medicine.
How I got into newspaper reporting. Well, I was always interested in newspapers. I actually had a very failed elementary and brief high school career in acting, and it didn't go anywhere. I spent a lot of time in high school, my high school newspaper, which was weekly, not that common for high school newspapers to be weekly. And then when I went to college, I got very involved with the daily college paper. I spent probably way too much time there for my own good, and tried really decide I wanted to have a career in journalism. My father was a physician. I was always interested in medicine and science as well. So I became interested in finding a way to write about medicine for a popular audience, for a general audience. So that kind of was my goal. After college, I graduated in the late 80s. There were not a lot of jobs in journalism, and there were no jobs in daily journalism for me. So I took a job for a science magazine called Omni Magazine, which incidentally happened to be published by Penthouse. So it was a very interesting place to be straight out of college working as a kind of naive 20-year-old. But it was I spent 2 years there and then decided I wanted to go back to graduate school and get a deeper grounding in history of medicine. And while I was in graduate school, I still was interested in journalism. I couldn't quite kick the habit, even as I was thinking, well, maybe I wanted to go into some form of academia. And when I was done with graduate school, I really decided I wanted to try to work for a newspaper. And I had done a summer internship. I'd done a lot of summer internships during graduate school, which was a lengthy process. And I got a job covering education at one of those newspapers, which was the Miami Herald. So from there, I've kind of I worked for the Herald for 4 or 5 years. Then I was freelancing in Boston while my husband Peter was doing residency. And then a former Herald colleague recruited me to come out and work in Indianapolis. So we came out here. I thought it was probably going to be temporary. Peter didn't have a job. He has an MD PhD, so he's a little quirky too. He wound up at the IU Center for Bioethics, and he never wants to leave. He loves Indiana. I'm a little bit more movable, but he loves Indiana, and he really loves IU. So it's a good place to be.
Well, we love you guys being here. And as I said to you in conversation, that I hope that at some point we'll be able to bring Peter on for a program on bioethics, and particularly as it focuses on the issues that we're dealing with at this point. We're thrilled to have you here. Well, I presume that newspaper reporting and journalism has not been during the past year quite what you had expected it to be when you started in the profession. What adjustments, what retooling, what new learning have you and the newspaper needed to undergo since the onset of the pandemic just about a year ago?
Well, the way everything has changed with the way we do, obviously, just as for anyone else in a workplace. We are not back in the office yet. We are exclusively work from home. All of our meetings, most of our discussions now are done through Microsoft Teams, which is an online chat program, though we do also have the capacity to have video meetings and audio meetings through Teams. The biggest change for me covering medicine is it is just a fire hose of information. I have never written as much as fast as I have in the past year. I would say on average, I'm writing 8 to 10 stories a week, which is really unprecedented for my career. And the type of, medicine was always a little bit, there was a mix of breaking news and a lot of features and more what we call enterprise stories. And there always was breaking news in it, but now it is kind of continual news, and the work just doesn't stop. And then, the newspaper did a really good job. The Star, we have a new editor who I think started 3 weeks before the pandemic began. She isn't even physically in Indiana yet because she hasn't been able to move. I mean, this is a crazy time. And she has a family in South Carolina and trying to get them here. So she's organizing all of this from afar, but she retooled our newsroom so that we had a lot of people focused on questions of economics in the pandemic. We already had an education team in place, but we really all turned, especially in the spring, we all took a slice of coronavirus / pandemic life and started writing about it. And that's been very different. And I think we've never had an all-consuming subject like this. So now we're trying to figure out how you come out of having an all-consuming subject like that, like everyone else. How do you return to some semblance of normalcy? So I think the challenges that we had are going to continue moving forward. But so far, I actually think our management right now is really in a good place for solving and sort of working things out as we go.
You started talking about challenges. I'm wondering what types of challenges have you found as a reporter in trying to convey and explain the news and get the basic message across accurately, but in lay person's terms? There's a whole new terminology, both scientific and social, that has emerged over the past year.
So I will say that is one thing I think that, as someone who's worked in journalism for a while and has done specialized training, that hasn't been as much of a challenge. I am accustomed to writing about medicine. I'm accustomed to being aware of the fact that the language that sometimes doctors speak in is not necessarily the most accessible language, and sort of how over the course of an interview, you make sure that you understand accurately how to convey that information to the public. I think we talked about this earlier, you and I, Dennis. For me personally, one of the biggest challenges has been that I have never covered as political a medical issue. And personally, that there are some days that is just, and certainly has been in the past, I have found that just demoralizing, how politicized this pandemic has been when we're talking about real people, real lives that are being lost or completely altered. And yet I'll get besieged with emails like, this doesn't exist, fake news. And I just sort of think, but the hard thing is to read this, and we're supposed to respond, but sometimes it's kind of hard. I kind of have a rule: if you curse at me more than 3 times in the course of an email, I'm not going to respond to you. Because we do. I mean, we get a lot of sometimes vitriolic email, to the point where you're just like, okay, I didn't create this virus, I didn't bring it on, clearly you're very upset. But it's also upsetting to see how quick people are to devalue the reality of something that is so devastating to many people.
Let me follow that track. So in what ways would you say that last year's issues, and we can consider many of them, law enforcement, social unrest and protest, blossoming BLM, Black Lives Matter movement, and the elections added complexity to the reporting, and perhaps even treatment of the pandemic?
So I think certainly the elections, the politics, the Black Lives Matter movement, which we reported a lot on in the spring and summer, and then it's somewhat quieted down, which is, one would hope maybe that there would be some change there. But in terms of how this all ties in, I think it also plays into this recurring divide between kind of the educated and the non-educated, or the elite, non-elite in our society, that also weaves through some of the political divisions that we've seen and heard and continue to see and hear. I think it weaves through perhaps some of the rural-urban divide that we see, especially because early on it was a pandemic that was largely urban. The rural areas didn't see the same numbers that the urban areas did. So it was, I think, much easier for someone in Fortville to say, oh, the pandemic doesn't exist, than for someone in Brooklyn to say it. And I think, I'm sorry if you hear banging, but I think that these are divisions that are, even with the turnover in the presidential, in the White House, we're going to continue to see, and we're going to continue to struggle with, because we have such a divided society when it comes, starting with education. I mean, I think the education is not, we are not all on board with what creates fact, with what creates knowledge. People saying that they doubt medical experts. I always sort of wonder, why would the CDC lie to you? What is in it? As a journalist, you're always suspicious of people, right? That's what we do. But you also have to kind of think, okay, well, what's in it for them? And the distrust, the level of distrust is really depressing, for lack of a better word. And I don't know how you bridge those gaps and create that distrust. I mean, sometimes I remind myself, well, at least they're writing, at least they're talking. At least they're starting to have a conversation with.
Has the readership of the Indianapolis Star changed at all over the past year as a result of what's going on and the need of people to stay more connected?
We've actually we've seen an increase in digital subscriptions. We've also pushed on that. We've offered deals, and I think that the other thing that a new editor has brought over time, as there has been kind of sort of more time to stop and think is we are doing a little bit more coverage of traditionally underserved communities. They started a newsletter called La Estrella, which is daily, I think it's daily, but it's aimed to attract Spanish speakers. So it's a free newsletter that can it goes out to about 12,000 people for whom Spanish is their preferred language of reading. And we've never had anything like that before. So that's been something positive that has arisen out of, if not the pandemic, certainly out of where we are in this time.
So I should tell you that La Estrella de Panama was the name of the newspaper in Panama when I was growing up. So,
that's fun. Well, then
so perhaps I should write something for La Estrella.
well, it's a newsletter, and I'll be honest, I'm not bilingual. I've tried. My son is learning. My 8th grade son is pretty good at Spanish, so I'm trying to encourage his teacher to take a look. But I should tell
with the editor.
Well, there's not. It's two women. One is I think Colombian. The other one is Mexican. They both work at the Star. They both came here as young girls. They didn't know one another before, but they were working together, and they thought this would be a great idea. But I will mention it to Natalia, who is
Estrella, of course, means star.
Star. Yes, yeah.
Which is also the name of the heroine of the book of the Megillah that we just read, right? Esther.
Right, exactly.
And the word goes back to the Persian, and from the Persian to the Babylonian, right?
I didn't know that.
Absolutely. So that was her Persian name, not her Hebrew name. Anybody knows her Hebrew name? What was
Hadassah.
that? Hadassah. That's correct. She is the patron saint of the Hadassah organization, which brings us back to medicine. You see,
right.
Everything is connected. Well, the pandemic is, of course, a viral infection that attacks the body physically. But what can you tell us about the consequences that it has had on the community? Mental health, familial adjustments, educational impacts, because it is pervasive in so many fields.
So I think it really has been incredibly pervasive. I think of the work of my colleagues, Emily Hopkins and Tim Evans and Tony Cook, who are doing a lot of work with nursing homes, and they've done a lot of reporting on how it's been so isolating for people in nursing homes. They haven't been able to see their loved ones. They've been shut off. Sometimes they don't even understand why, if they're dealing with dementia issues or other mental incapacities. And it goes down from the oldest of the old. I think there are probably many of us who haven't been able to see our elderly parents if they live in another state, or our adult children if they live in another state, or our grandchildren. Our children have been out of school for great stretches of time, perhaps less so in Indiana for some kids at least than in other areas. My college roommate in Washington, her child hasn't been in school since March physically. It has meant people have lost jobs, people have lost homes, people haven't been able to feed their kids, restaurants have closed. I'm a little bit younger than you, Rabbi Dennis, and I can't think of anything in my life that has been comparable in any way, shape, or form to something like this.
Well, I remember 1918, of course.
Yeah, no, not in my life, but
yeah, it's. I think everybody can add a piece to that story. But since you mentioned nursing homes, I'll take this opportunity to advertise our program on Sunday, March 14. We're starting a new series in March on Sunday mornings, Coffee Talk with Rabbi Dennis. And on the 14th, March 14th, I'm going to be conversing with Evan Lubline about Hooverwood and the impact of the pandemic in nursing homes. And so that'll be relevant to what you have said, and a good segue. Thank you for that.
That was not planned. I just want everyone to know that.
Everything is connected, right?
Yeah.
So could you comment a little bit beyond medical issues? What other areas have you continued to report on? And has there been a connection of any topical or otherwise, in your other articles? Or
So I will be honest, I think I have written 3 or 4, well, aside from we all have to do weekend shifts periodically. But I think I've written 4 or 5 articles since March 6th that have not been coronavirus related. And that's out of like, I don't even know how many, 300, I mean, more than 300 articles. I did do a little bit of reporting. We all chipped in during the Black Lives Matter protest, and I did go down and do some reporting on that. I sadly covered the funeral of Chris Beatty, who is he was shot downtown trying to intervene. He sounded like an amazing guy. The funeral was a cathedral, and not a dry eye in the place. He was trying to protect 2 people who were getting carjacked, and he was shot. Other than that, I wrote one story about systemic racism in medicine after the death of a Black female physician well, she was treated at IU Health North and alleged racist treatment there. And then I wrote one story about liver transplants. And literally since March, those are the only non-COVID related stories I have written. So I've written, I mean, there is not time to list how many COVID stories I have written.
is there any plan to collect these? Do they have any type of afterlife to them?
No, unfortunately, no. I mean, I think you probably will be seeing books that come out of the pandemic. I don't think you'll be seeing a book that comes out from the STARS experience of the pandemic. And one of the, I think one of the reasons is that as journalists, we're acutely aware that there's not going to be an end to this. I mean, it is going to be hard to say, even once we're all vaccinated. And this is actually a story I'm interested in doing. It's a very high concept story. I'm sort of in the early stages of working on it, but I think it's really changed for most of us, the way we think about medicine and the way we think about our bodies and the way we think about ourselves as kind of biological entities in the world. I think, or at least I think it's changed the way we think about germs. I mean, certainly I have 2 kids. I was among the people who would go to the Children's Museum following them with hand sanitizer and saying, wash your hands. But I never really felt threatened by that. It's like you just did that because you didn't want your kid to develop a sniffle. But now I think, we really do feel like the next corner could hold a deadly germ. And I think that's something that maybe we as people in the United States have been privileged not to feel, whereas maybe people in other countries have been more aware of it and more concerned about it. But I think our attitudes have changed forever about that.
It has had a definite and will continue to have most likely an impact on also how we view social relations and
Sure.
closeness and interactions, perhaps expressions of friendship and the way in which we relate and interact. Shari, now that we are in a kind of a forward movement with the vaccination process, could you look back on how earlier moments or facets of the pandemic, testing delays, contact tracing, social distancing, you already began to talk about hand washing. How were these and how will they remain important concerns? You already began to touch on that. How do you foresee people will begin to behave as the vaccination process unfolds? Will that liberate us, free us a little bit more, or where is the balance going to be?
I think it's going to very much be a kind of a small c cultural differences depending on where you are. I don't know how active you are, if you're active on Twitter, but there already have been 2 videos posted from the past 2 weekends of nightclubs, one downtown, one up in Fishers, and there's not a mask to be seen. I mean, and people are clustered close and raising their glasses and dancing to music. And they're all, I noticed that the one in Fishers was a little bit closer to my age. They all look to be a little bit middle-aged. The ones downtown are all young. I mean, I think that it's really going to depend on who you are with and what the protocols are. I mean, I will say, as I was getting ready for this, I was thinking, oh, wait, what mask do I want to wear? And I was like, no, it's a Zoom. But it's just like when you think in certain groups, when you think about being with people, you think about masks. And it's interesting to me, my kids who have been in school for most of the time are completely used to wearing masks. And this weekend we were at Holiday Park, and my younger son, who's about to be 11, and his friend who goes to school with him were the only two kids at the playground wearing masks. So I think it's going to be very easy to shed it, except when you're in groups that still think, okay, we're going to be careful. We're going to, we're just going to wait and see. And then I think what will happen if we're safe, then we'll all stop wearing masks until we hear about the next variant. And then there's a flurry of fear.
Do you have any insight into what the NCAA tournament that's coming to town might have in store for us?
Yeah, I know that a lot of medical types feel a little queasy about it. I'm not so worried as much about the games. I think that the games are going to be fine. I think they'll be careful at the games. I don't know. I really don't. I mean, at the end of the day, if you have no one there who's sick, nobody else is going to get sick. But if you have someone there who's got the virus and doesn't realize it, or kind of isn't feeling well, but God, they just paid $300 for this ticket, so they're not going to stay in their hotel room. They aren't necessarily going to have a fever. I don't know. We'll just, you just sort of have to say, okay, not my decision. And I will say this, I don't envy our public officials in this day and age. They cannot make the right decision. No matter what decision they make, it's the wrong one. So, I think this is a really, really tough time to be a public health official.
Well, some of your reporting has involved your participation in governor press conferences, right? You started talking about the public officials. In what way do you see yourself just as a reporter, and in what way as an advocate, or at least an educator in the area on which you are reporting? And what has been your interaction with public officials and those press conferences that the governors mentioned?
Well, I think that for most reporters, there's a level of advocacy involved, depending on what group and I would say, as I said, getting into this field, I was interested in advocacy and education for the general public. So the kind of letting people know how they can live a healthier life, what they need to know to live a healthier life, and also letting people know what I think. I grew up in a house, and my father was a doctor. I mean, it was medicine was pretty esteemed, but I also am acutely aware that sometimes doctors make decisions, or health systems make decisions that are reflective of the society in which they live, and they don't necessarily always have the 2020 vision that you need to make the best decisions. And I think that's true of public health officials. I mean, I think when Governor Holcomb started opening up the state in October, I just thought, what are you doing? I mean, I felt like they knew better. Basically, they were going against what they had told us. And to this day, I'm not sure. I don't know. Maybe Governor Holcomb, in retrospect, says, yeah, we made the right decision. We would have had the same spikes in November, even if we hadn't opened up the state. But I'm sure that Dr. Box was getting advice from somewhere that was telling her it was okay. I think she was. I don't know. I mean, I don't know. I don't know what went on behind the scenes there. And sometimes you find out only after the fact. So.
Well, I think we can say in hindsight that 2020 vision did not turn out to be what we would have wanted it to be, right?
No, not at all. So.
I'm going to ask you one more question, and then I'm going to invite people to perhaps post some questions in the chat box, so that Shari and Jackie can help me ask you some questions from what the public is interested in, or we might even open it for questions. One more question. You wrote a piece about pandemic fatigue among the pieces that you sent me. Could you say a word about that? Are we ready for, and will we be getting a reprieve? Speak as a citizen, speak as a thoughtful interpreter of society, speak as a mother, and give us a word of caution, give us a word of encouragement.
So I will say, I think if you look at when I wrote, and that was in September, right? Do you have the date there? I think I wrote it in around September something. It might have the date.
I will have to look for it. See, now that you are going to be free from writing so much on this, how are you for the High Holy Days? Available for any ghost writing? For
Yeah, well, it's actually funny that you mentioned that, because, and I'm going to start off, given this audience, I think it was around September that, I mean, I really hit, the summer had been bearable, right? And then we were getting into the High Holy Days. We had Passover. Our family had, like, I don't know, 3 or 4 Zoom Seders, which, no offense to Zoom Seders, but they were horrible. I hate Zoom Seders. I hate Zoom.
Found it.
Okay. When was it?
Pandemic fatigue, September 4th.
Okay, right. So we were getting into the High Holy Days, and I started to realize, not only, wait a minute, it had never occurred to me that by Rosh Hashanah we would still be in the same rut. And I mean, I really missed, I don't think I have ever missed in my life before some form of being in services on Rosh Hashanah and Yom Kippur. I mean, I'm not saying, have I always sat there from start to finish? No. I mean, I'm a normal congregation member, right? I mean, we all mean well, but there's never been a time where I haven't been in the synagogue during September. And it really hit me hard that was going to be the way, that was going to be the way life was going to be. I mean, and I will say, like, so words of hope and encouragement, again, talking about September, to be honest, I have one of my best friends from high school is a cantor in Forest Hills, New York. So I was able to go to some of her services because all of a sudden everything was on Zoom and it was accessible. So I think moving forward, we are going to have, you asked about words of hope. I think there are going to be some positive things that come out of this. I think we are become a more technologically adept society. And I also think that a lot of us, when we reach that pandemic fatigue part, because I think most people did, is it helped clarify what was really important in our lives to us and what we could afford to miss. So, I mean, talking about pandemic fatigue, I think most of us have had pandemic fatigue since the fall. I mean, I don't think anyone saw us being in this through 10 months, 11 months. And now we're not even still fully out of it. Even the people who are vaccinated are being told, well, wait a minute to take that mask off, wait a minute to travel, wait a minute to see your grandkids. And all that's really, really hard to ask people to do. So, but I do think there's got to be an end, right? I don't know. I'm not a futurist, so, nor am I an optimist, but I do think there's got to be an end.
Hopefully, the way things are moving, we are moving in the right direction. They still anticipate some type of an increase later in the summer, but by then more people will be vaccinated, right? Can you tell us something about vaccinations and how you think, as a reporter, that has been moving, and what would you give any advice to the governor and to the state officials on how to move it in a better way?
I don't know. Again, this is the question of how do you judge something? I mean, I think our governor and our state officials are doing what they think is right, and they're moving ahead. I don't really have a dog in the fight. It would be lovely if we could all be vaccinated. I mean, I think the most confusing piece of the whole vaccination has been the state by state differences. I think that the idea that different states would have different rules just made everything much more confusing than it had to be. But that's not on our governor. That's on the administration that was in power when the vaccination rollout began. So.
Okay, I am beginning to get some questions from our participants, so I'm going to turn to that. Claudette Einhorn raises the question, there was life before COVID. What were your topics before the pandemic?
I've only at the Star, I've only covered health and medicine. So I've written about I've had the pleasure of interviewing Mrs. Einhorn's husband and writing about some of the work that he's done. I've had the pleasure of writing about organ transplants. I've written very optimistic stories. I've written about disparities in healthcare. I did a lot of reporting with the Scott County opiate outbreak and the HIV outbreak down there. I've done a lot of reporting about opiates. So really the whole gamut, but almost exclusively medicine here in Indiana. Oh, I also used to write, hot for fun. Oh, right. That's right. I used to have a fun life, or something that was fun. I used to write those, contributed to the hot properties where we would go in and tour houses that were for sale. Something that like you would never do today, right? Like go into someone's house, a stranger's house, and walk, and yeah, we would, I can't remember the last time I've been in some of my closest friends' houses. Seriously, I haven't. I've been in their backyards, but unless I have to go to the bathroom, and then I usually go home to use mine. So
look, here you are inside of 40 different people's living rooms, sharing. A question from Marcia Goldstone. We're all aware that the economics of local journalism are very difficult, and the Star has changed significantly over the years. Have you seen an increase in readership because people want to have local information about COVID?
So we do have that, and we do have, we do track everything very carefully. We do know how many people click on our stories and then how many people subscribe. We have a sort of a way of following that. The COVID stories tend to do well. So the COVID stories have done well, but so I'll tell you, the COVID stories though, compared to a good sports story, you just can't compete in Indiana. People really want those sports stories. I am just not Greg Doyle. So
you wouldn't switch to sports reporting, huh?
No, I don't think anyone wants that. Let's just say that.
Something that is probably hard to report, says Miles Siegel, is the degree of uncertainty about the present, the future, and COVID in general. All politicians and many doctors seem more certain than they realistically can be. How do you cover that?
Well, the nice thing is, when you talk about politicians or doctors, is that often they may be certain, but they may be certain in different ways. So, for instance, take Mayor Hogsett and the NCAA. They're reasonably certain, I love Virginia King, but she was saying that she's more worried about spring break than March Madness. So she's reasonably certain, or is going to say she's reasonably certain that it's not going to cause a problem. But then you can turn around and find some doctors who are less than certain. So that's one of the, for me, actually, one of the interesting things about being a journalist is that nothing is black and white. And I really am drawn to those gray areas of debate and discussion and discourse, and how you kind of weigh those off one another. And a lot of times, I find myself saying, I don't know. I can tell you what this person said. I can tell you what that person said, but really, who knows? A year ago today, who would have thought we would be here on our couches staring at boxes on a screen? We would have thought, oh no, if this is happening, it'll be used to meet in a restaurant or in the synagogue. Why would we not do that? So.
Yeah, I should say to Miles also that whenever we talk about past, present, and future, things get tense.
Ha, ha, ha.
Carol from Kokomo says, my sister-in-law and 2 nieces are all teachers in Illinois. They all have gotten the vaccine. My niece said yesterday that all teachers and essential workers, including grocery store workers, can get the vaccine. I wish that it were that way in Indiana. Any comment on that?
The only comment on that is that I also see people in California and Illinois saying my 75-year-old aunt still hasn't gotten the vaccine yet. Again, I think it is confusing that there are differences across states. If I had, if I could wave my magic wand, we would have had a federal policy. I think it would have made it clearer. And I think it would have, I think now there's this real fear of missing out, that I don't have the vaccine. Hell, I'll be honest. I feel like I want, I was with a group of, my husband's a doctor. I was outside with a group of people, all masked, and myself and another friend, maybe 3 of us weren't vaccinated, and 7, the rest of them were. And we kind of felt like, the pariahs. We're ruining your party. We're all making you stay outside because we're not vaccinated yet. So I think it would just have been easier. And that would have happened even if there was a federal rollout. But I'm just saying it would have been easier so that you weren't looking at across state lines and saying, well, I could have been vaccinated here, and then people there weren't vaccinated. So hopefully there won't be a next time, but maybe they'll know for the next time.
Maria Simon wants to know whether you're considering a story regarding the impact of COVID on the opiate epidemic. She is hearing mixed messages, but understands that opioid overdose is on the rise.
So I wonder, did my editors plant that question, Maria? Are you in concert with them? I've actually had that story on my story list for about 2 months now. I think there definitely is a rise in opiate overdoses. There's definitely a rise in suicides. One of the things I don't, and I think it's more, it may be more overdoses. I'm not sure. I'm sorry. I can't remember if you asked about deaths or overdoses, but just as the pandemic was starting was when naloxone use got to be much more common, say the 10 months before that, which is a good thing. So, that has saved people from dying. But then the question is, you were talking about pandemic fatigue and mental health side effects of the pandemic. I think people who are dealing with substance abuse issues and isolation, it is just really hard. It is just really hard to do it. Sorry, my 10-year-old is, what? Sorry.
Need a little reprieve?
No, I'm just trying to hold on. Can I hit mute for 1 second and ask Solomon what he wants?
Tell him to say hi. Let's see him. King Solomon.
No, he ran away, and I didn't even tell him that some of his Sunday school teachers were on.
Oh, yeah. Terrific kids. We have a question from, I think I skipped one here. They're coming in quickly. Here we go. I have to go up a little bit. What are you hearing about immunization bubbles? Groups of people that are fully vaccinated getting together indoors without masks.
Well, I can tell you that I did a story about where I spoke to a couple of doctors and said, okay, people are now vaccinated, now what? And they said that for the most part, those immunization bubbles are pretty safe. So I think people, especially seniors, older people who are getting vaccinated are going to start doing that. And I think from what the experts are saying, there's probably nothing, there's nothing wrong with that. I think it gets a little bit confusing. I don't know if other people are going through this. I'll be honest, my 83-year-old mother in the Bronx, she's vaccinated. My husband's vaccinated. We want to go there and see her over Passover, but I'm not vaccinated and my kids aren't vaccinated. So that's where it gets a little bit confusing. And also, who's at risk? I sort of feel like we're both at risk when I'm talking to my mother. She's elderly, thankfully in reasonably good health, but I think the word from the experts is really, look, if you're all vaccinated and you're in a small group, you're okay, Yeah.
Children will not be vaccinated, so
right.
Children still are going to school in any case. So Carol is asking, my daughter is in the classroom, but had to go to Walgreens to get it as a teacher. I presume the vaccine. The seniors are the only one besides the healthcare workers that get it at the hospitals. Where is that, Carol? Okay, can you comment on that? Daughter, teacher, had to get it at Walgreens.
We don't have it at Walgreens here. So we have it at Walmart.
City.
What?
Must be a different.
It might be a different state. So I can't really comment. And I know that the seniors can get it at Meijer. Seniors can get it here. Seniors can get it at Meijer, Kroger, and Walmart.
Walgreens is based out of Deerfield, Illinois, and they have consented to give it to the teachers. You have to get an appointment, but somebody from the Deerfield School District called them and said, would you do it? And they said yes, so they invited the teachers. My daughter teaches in the Buffalo Grove schools and works with the handicapped kids, so thank goodness she was able to get it. But the teachers in Illinois, it's only Indiana of all of our surrounding states that don't give it to the teachers.
Yeah. Well,
and Walmart was giving it to the teachers and was told by the governor to stop. Yeah,
that's the problem with not having a federally mandated protocol. Yeah. Tracy, Michigan. Oh, this is a question for you and for me, Shari. As we know, is that as we know or as it is well known? Rabbi Dennis loves puns, and so do the writers of newspaper headlines. Question for both of you. When do you avoid wordplay? Do you use wordplay in your writing, Shari?
Not as much as Dennis does. It's kind of the temptation to say, but not during COVID. No, I haven't. I mean, I'm pretty aware. If I were writing a light piece, I might, and I think that's probably, I mean, I've only, I think when the my sense when the rabbi calls for a somber occasion, you're somber.
That's right. Yeah.
But I'm always happy to have a pun off with anyone, Tracy, if you ever, should you ever want. So.
Okay, well, you have to be very careful with how you use words.
You're tempted.
Levity and gravity have to be gravely weighed. Okay, yes. Sandy Sasso. Oh, I thought somebody wanted to ask Sandy Sasso. Sandy, oh wait, Stuart Fox finds it very interesting that the flu is almost extinct this year. Comments about that? The regular flu.
Oh, I think we've seen experts say that. I think it's probably just, no one's anywhere, right? Or a lot of people are staying home. We're wearing masks. I mean, I know that I go into the hospital to do a story maybe once every 2 weeks or something, but I'm never in the newsroom. My kids are not having sleepovers. They're not going to birthday parties.
Avoidance of contact.
Yeah.
And Sandy Sasso would like you to comment on the state legislature's desire to limit the governor's emergency powers in the future. You have a thought about that?
I think that the state legislature is an interesting body, and I'm not sure that, I think we've seen in the past 2 weeks that they represent a certain segment, but perhaps not all of Indiana. I don't really, I think the governor is willing to work with them and maybe figure out a way, maybe figure out a middle ground. He's alluded to that. I think from a historical standpoint, without getting too political, I think there is a reason that public health officials were given the authority that they had to say things like you're now in quarantine. And let's remember, this is the whole notion of quarantine is certainly not new to coronavirus. I mean, even in the modern day, if you traveled and picked up measles somehow, or if you picked up a drug-resistant form of tuberculosis, the local health officials could still, kind of ask you to quarantine. We've seen that with other, at an incredibly infinitesimal scale, but we've seen that with other public health emergencies. And as is often the case with the state legislature, I'm not really sure whether they're driven by politics or if they're driven by, I don't know what drives some of those people.
Yeah, interestingly, I wrote a little piece about this early on. The word quarantine is technically inappropriately used because quarantine refers to 40 days of isolation. And the term surfaces for the first time in medieval Venice, where ships were held off bay if there were any reason to suspect that there were contagious diseases. So we are way past quarantine here, way past 40 days. So Moses was in quarantine on Mount Sinai for 40 days and 40 nights. I don't see any more questions, but I'd like to ask you a question myself. What newspapers do you read? And how do you shape your own opinions nationally about issues?
Well, when you say read, the only newspaper I get in print every day is the Star. And by this point, I've now usually read most of what's in the paper because we have a digital first policy. But I regularly, I'm a digital subscriber to the Washington Post and the New York Times. And I don't I have unlimited access to USA Today as well. And we sometimes work with USA Today. So that's a little bit kind of internecine to talk about reading that. But I read the Post. I read a lot of, a lot of the Post online. There's a lot of the Post, and I read the Times. I also read the Times, the Sunday Times. I read the New Yorker also, which has a lot of excellent reporting. I'm about a month behind in the New Yorker, so sometimes I'm sort of reading and I have to remind myself, oh, right, Trump isn't still president. That happened. Right, we're past that. But those would be the other journalism, and I listen to NPR pretty regularly. So
we read and listen pretty much to the same thing, except that I have to read the Wall Street Journal as well to be able to converse with some of my congregants.
Yeah, I mean, I'll be honest. I interned at the Wall Street Journal, and when I was there, I learned that no, this isn't the same. It's not the same world I travel in. So, and I look at the IBJ for sure. I should say that. I'm sorry, I didn't include them, but they're a major competitor. But yeah,
we should get the IBJ to do a Spanish.
Yeah.
Well, this has been a wonderful conversation, and perhaps there are some other questions. That's the end of the list of questions that I have, other than Tracy's remark to my remark, which was simply snort. But I would love to have anybody who would like to ask or say something in the next 5 minutes before we close the conversation to feel free to do so. Just raise your hand, and if I see you, I'll recognize you. I can see 25 people at a time. Anybody?
I think Rabbi Sandy has her hand up, or finger.
I have to recognize her? Okay. Unmute yourself, Sandy, please. There you go.
Yeah, I have a more general question of where you see the future of journalism, and will there be a print newspaper in the future where everything be online? Are younger people getting their news from the papers that you and I are reading? Where do you see the future going?
I don't know that many younger people are getting the physical paper. I do think they read online. I think there's a lot of shared news that goes on. I mean, I see it in my own, well, not in my 10-year-old, but I certainly see it in my 8th grader. I think that there's definitely still a place for news. And I think if anything, this shows us that there is. And I think it's, for better or worse, I think that one of the things that the pandemic, or maybe I hope this, I don't know if people beyond my brain agree with this, but I think it showed us the power of stories about people's lives, and how reading about someone's life can broaden you beyond what you see on the 30-minute TV news spot, or the 30-second TV news spot. I mean, I really do believe, there is somewhat of a role. I don't think it's an accident that podcasts have just soared, especially during this time. And I think maybe it is going to be that news is delivered more like a podcast than like, I don't know. I mean, I think we're going to see lots of testing. I am not a person who likes to be given my information. I prefer to read it than to hear it. It just sinks in better for me. But there may be people who it sinks in better if they hear it. So I think we're going to see a lot of different means of delivering the same type of information. But I do think that there is still going to be a role for journalists moving forward. For the most part. I mean, I think it's going to be different. I don't know if that answers your question.
I see Stuart Fox wanting to ask something. Unmute yourself, please, Stuart.
Yes, hi. You were saying that you like to read the paper. I get it online, and I actually have it read to me, and I read it at the same time. It seems to sink in better. The only problem is I can't interrupt the sound and then go read. I have to go back to the beginning. But I am able to absorb it a lot better that way. Interestingly enough, you saying the young people don't read the paper, but today there were 2 environmental articles in the paper, and I forwarded to both of them. I forwarded both of them to my granddaughter in Carmel, who's a senior in high school, and she's interested in the environment. And so whether she wants to read the whole paper or not doesn't really count. I just send her the parts that she's going to be interested in.
Yeah.
I will say, I mean, I think that's great. And I think one of the things that we lose as a community when people aren't reading a paper is the kind of serendipitous stories that you would come across. I mean, that's one of the reasons I like to read in print, is because sometimes I might not necessarily read. I might read a headline and not realize I actually want to read the story. But if I'm flipping through a newspaper, I'm more likely to find myself reading a story that I might not have otherwise read. And for me, the perfect example is sports stories. I mean, I would probably never go and click down sports stories to see what was there. But if I'm looking through a paper and I see a sports section, I'm more likely to start reading. I can't tell you why that is. It's just that just catches my eye and engages me.
Yeah.
So
I like to read from the piece of paper. In fact, if I want something that I read online, I forward it to my secretary at the office and ask her to print it, and then I read it. All of your articles that you sent me online, I would not read them online. I want to read them with a pencil in my hand and a highlighter and own them. I have drawers full of printed articles since the beginning of the pandemic that I return to from time to time. Well, thank you, Shari. Continue to write, continue to inform us. Most importantly, we're delighted that you, Peter, and the boys are engaged in the synagogue. And hopefully we hope that we can see you in the synagogue before 2021 is over. It's been too long for all of us. Thank you for keeping us informed and sensitizing us to important things that are happening around us. And perhaps if you introduce me to your Spanish editors, we can do a little conversation with them sometime about keeping the Hispanic community informed. And we'll do a little program about the Latin American, Latinoamericana, La Comunidad Latinoamericana. Don't say Latinx. There is no such a term. Tell your people.
well, yes, we use the term Latino, so
Absolutely.
Latino, yes.
You can say Latino, you can say Latina, you can say Hispanic, but Latinx is, I have asked a lot of Latins, they don't like it. 90+% of Latins don't recognize or identify with the term. It's somebody's invention.
Right. Right. Thank you very much for inviting me. Thank you all. I hope you all
Thank
stay
you.
well, and
You be well too. Bye, everybody, and thank you.
bye.
for joining
Take
us tonight.
care.
And next week, oh, don't leave. Next month, April, we are going to have Professor James Madison of Indiana University talk with us about his new book, The Ku Klux Klan in the Heartland. And he is a very, very highly respected historian of Indiana, and particularly respected in this area. Thank you all.
Thank you. Take care. Bye.
2 years ago, you were with us for Purim, Shari. Remember that? You were in our Purim. You were one of our Purim presenters.
Yeah, I think it might have been 3 even. It
3
was a-
years ago already.
Yeah, yeah.
It was a terrific program. Thank
Well,
you.
thank you so much. Take care.
Bye-bye.
Bye.
Thank you all, Shari, Jackie, and everybody for joining us tonight.